Right, okay, well, we are missing people, and I'm sure that some will come in because that usually happens, but I want to say thank you for being here. I'm Jamie Hanna, and we're so pleased to bring fall prevention to you today. We have a packed itinerary, a lot of different speakers, so I'm going to go ahead and get started, and don't worry, I mean, take notes if you want to, but I will also send you anything you want afterwards as well as all the resources, okay? So I just want everyone to be, will you shut the door because I know you had a trick. Yes. All right. So just a little housekeeping. Please do not exit that door right there. That's our administrative hallway, and we have like really important meetings, and the gal that writes our paychecks, and if she gets disturbed, my paycheck might be late. So I would really appreciate it if you guys would exit this way. And same if you have to go to the bathroom or get up and get a drink. Kind of importante. Yeah, and cell phones off, please, or silenced. And we're going to save questions for the end, okay? Because we have a lot of information, and just want to make sure we get to everyone. And one of my speakers is coming 15 minutes late because she's teaching a class right now. Oh, never mind. She's 5 minutes late. I take that back. Hello, Laura. That's okay. That's okay. All right. So the highlights of today's presentation, as you read through them, you'll see quite a bit of information, and each presenter is going to share their expertise in the world of falls as it relates to their area of expertise. And so we're barely going to scratch the surface today, truly. We've got so much information. We've got the good, the bad, and the ugly of falls. And we all know there's all three. So the goal today is not to do this. Good morning. Hi. The goal today is. Oh, you did. Oh. The goal today is not to do this one-time fall prevention presentation. It's to have an ongoing dialogue, an ongoing resource, right? We want to be continually providing resources and helping because falls can be prevented. And truly, we want to be part of your fall prevention team. And this works. I've done it at other YMCAs. It is amazing, the collaboration when we invite first responders, personal trainers, physical therapists, senior service directors, nurses who've seen it all. And we bring everybody together. We go, oh, and now we can identify some of these fall hazards and work together, because a lot of people are just simply unaware of some of the risks. So again, I love this. It's a proactive approach that includes you, your doctor, your family, your church, your neighbor, everyone, right? So the goal today, the takeaway from today, I want you to all just create a fall prevention team when you get home. That'll be your homework, and I'll check in with you. So I get to give you some stats. We drew straws. I got the short straw. I'm giving you the stats, the ugly falls. It's quite alarming, but every 20 minutes, an older adult dies from a fall in the United States. So this talk is 1 hour. How many 20 minutes are in an hour? I mean, it's kind of shocking, right? It's shocking. Falls are serious and costly. I mean, 1 in 4 Americans 65 and older falls each year, 1 in 4. And look at that financial toll. So this is 2020 statistics. The last time we taught this class, which was in 2019, we were using 2017 statistics. That was 33 billion from 2017. It's already 80 billion in 2020. That was 5 years ago. And more good news, if you're gonna love me by the end of this, by the year 2030, the United States population will have the largest 65 plus, and it will continue to grow. There will be over 71 million people by the year 2030 that are over the age of 65, and that is known as the silver tsunami. A lot of people don't like that word, so if you can figure out a better one, let me know. I didn't make it up. But the costs, right, are gonna keep going up. So, and falls can be prevented. Can falls be prevented? Yeah. Yay, okay, yes they can. All right. So we're here today to be part of your fall prevention team to help us. But one more yucky slide. Well, actually I have 3 more. The ugly, ugly truth. Okay, so 1 in 5 falls causes serious injury, broken bone, brain injury. Over 800,000 patients are hospitalized because of falls. 300,000 older people are hospitalized for hip fractures each year. More than 95% of hip fractures are caused by falling, usually by falling sideways. And falls are, if you have a weak stomach, close your eyes. Falls are the most common cause of traumatic brain injuries. And this fall did not cause a traumatic brain injury. And this is the mother of one of our presenters from a couple years ago. This is her 2nd fall. She fell the year before. The year before she had a little black eye and a little couple stitches. This time, she really, and she hit on her head, right? And so, even though this one didn't cause a brain injury, you could see how it easily could. This is a friend of mine down in Wairika. She had a knee replacement, which was fine, and then she tripped on a step and broke her femur above the knee replacement. So here's her kneecap, right? Here's her kneecap, that's fine. Here's her knee replacement, that's fine. But this femur right here is supposed to be up here and connect here, right? Sorry. Here's all the hardware, she's fine now. She's back at class, she's wonderful. This is not to scare you, this is to just make you be aware. We can prevent so many falls. So I want you to enjoy just a little humor after my horrible presentation. Stretch if you want to, maybe just your upper body, but if you would like, and then I will introduce our next speaker. While you stretch, squeeze.
I'm gonna interrupt really quick. Is anyone parked right in front of our building, like right at the front door? So there's a handicap sign indicating that there's a ramp to get up, but that's not actually a parking spot because it's a fire lane. So I'm really sorry I have to have you there, but there are handicap signs that I can help you find really close. I apologize for interrupting.
Okay. So we'll go ahead and let her exit really quick, and then I'll grab my water, my other glasses just in case. Oh, that's okay. We are recording and we'll take notes for you. One of us could move her. All right, well, is everybody still with us? Okay, we're off to a great start. All right. I'm going to introduce Mark Shea. Mark Shea is the Deputy Chief Fire Marshal at the Ashland Fire and Rescue, and in the interest of time, that's all I'm going to say. He's wonderful. Thank you for being here.
Good afternoon, everyone. Thanks for having me. Going to talk a little bit about our department and what we do, because quite often we're the first ones that you see after you've had a fall. I should have practiced this.
Just a right click.
So,
Right click.
Right click?
yeah.
Oh, sorry, left.
You got it?
Right.
Okay.
Okay.
Yeah, that'll be
There.
All right. Thank you. Ashland Fire and Rescue, we're an all hazards fire and EMS agency. What that means is that we respond to everything, not just house fires like fire departments did years ago, but house fires and vegetation fires, technical rescues, hazardous materials incidents. EMS agency means that we're the emergency medical service agency. So we are the ambulance provider for Southern Jackson County. In the city of Ashland, we're your fire department, and we're also your ambulance provider, but we're also the ambulance provider for areas like Talent, just kind of south of Phoenix, and then the whole unincorporated area here of the county. Last year, we responded to 5,916 calls for service. 723 of those were falls. So the way we get our calls is through 911, right? Folks call 911, say that they have a problem. And we're talking specifically today about falls. So what do you get when you call 911 and you say, I've fallen? Well, it depends on if that ends up being a priority call. How that's determined is you call 911, there's a call taker in the 911 center, and they have a script of questions that they have to ask you. Sometimes it might seem annoying, but it's a procedure that's followed every single time. And they're gonna ask you questions about your situation. So essentially, if maybe you broke a bone, right? You think you broke a hip or broke a leg, if you're bleeding, if somebody isn't completely conscious, if you're not breathing well, that would become what we call a priority call. So that's when we come to you with lights and sirens, and in the city of Ashland, you're gonna get the ambulance lights and sirens, and you're gonna get a fire engine lights and sirens, right? Because the days of, I call an ambulance comes and they're ambulance drivers and they put you in the back and they drive you to the hospital, those days are gone. We're trained medical providers and we have procedures that we have to follow when we get there. So we're gonna assess you, we're gonna see how you're doing, maybe give you some medication, and sometimes when folks fall, it takes more than 2 people, because we would have 2 people on an ambulance, to get you safely onto the gurney and out to the ambulance, and then we'll get you to the hospital. So a little bit more about our department. We operate out of 2 stations. So our main station, Station 1 on Siskiyou Boulevard, just outside of downtown, and then Station 2 here on Ashland Street. We have about 48 employees. Got an administrative staff that works Monday through Thursday. We have Fridays off. And then as far as response staff, every day, if we're at full staffing, we'll have a staff of 10. So at our main station, Station 1, we're gonna have a battalion chief that oversees kind of the supervisor of the day, oversees operations. We're gonna have this fire engine staffed with folks that can both provide medical care and be firefighters. We're gonna have an ambulance staffed that can do both. And then we're gonna have another ambulance staffed during what we call our peak times. So when we get the most calls, which is really 7 to midnight. That peak ambulance is just ambulance service. They're just medical. Here at Station 2, same exact staffing except for the supervisor's not there. So that's kind of our staffing for the day. I talked about all hazards, clearly, right? Out there at a fire. But we're gonna talk about how do we prevent falls while we look at this beautiful view of the scenery and an unfortunate fire. Some of the things from our perspective on how to prevent falls. When you're getting up, whether that be out of your chair or out of bed, take your time, sit for a moment, gain your balance, right? Don't do this too quickly. Don't just get up and go where you want to go. Keep your pathways clear, right? Know that little things can trip you up. Make sure you turn your lights on. Don't try and go up steps or down steps, down a hallway when it's dark. Make sure it's well lit. Use non-slip mats and grab bars. Now this is kind of specifically for kitchens and bathrooms. That's where we see a lot of folks fall, is kitchens and bathrooms. Floors are more often than not slick, especially in the bathroom. And so that's where it's important to not have that rug to trip on or have those grab bars in your bath or your shower. And then also important, not really fall prevention, but having a list of your current medications that you take. okay? Because I'd said earlier, right, that it's now more than just picking you up, putting the ambulance, taking you to the hospital. We're gonna provide some medical care, we're gonna do an assessment, maybe give you some medication. Well, it's important for us to know what medications you're taking so that the medications that we give you don't interact with that wrong, don't do something that we don't want it to do. Plus, we need to take that list of medications and give that to the emergency room staff when we get you to the emergency room. So having that ready, having that on a magnet on your fridge is really super, super handy for us. And then the other thing with medications is know how it affects you. Know that if maybe you get a new medication, it does make you a little dizzy, or it does make you feel a little bit different. That's good to know, because then you can talk to your doctor, you can talk to your healthcare provider about that. So that was a quick snapshot of Ashland. Ashland Fire and Rescue, thank you for the time.
Can you go to the next slide so they can
Yep.
enjoy the humor in between speakers? Okay, thank you, Mark. That was great. That was great. Okay, so introducing our next speaker, Stacy Romney. I'm going to let you introduce yourself to keep it brief. Thank you.
Okay, oh, I told you how to use this one.
I know. You're the pro. You're the pro.
That's me and my dog Susie. I'm a board certified family nurse practitioner. Have been doing family practice in the Valley for many, many years. And so I've seen lots of falls. I've seen lots and lots of falls. And so Jamie asked me to talk about what falls I've seen. And I'll get to that, but I was just going to talk about this. This first slide is talking about how I like to talk to families about, when I see somebody, especially over the age of 65, I will say, so have you had any falls recently? Because it's not something that they bring up unless they just fell. And just to kind of like, okay, and then that kind of makes me think, okay, so let's talk about how did you fall? Why did you fall? And I get into that. I also talk to my parents about falls. My mom fell down the stairs a couple years ago and broke her upper arm here. And and I'm like, so I talked to her. Just having that conversation also with your friends to maybe you're learning a lot of things about fall prevention today. Maybe making some suggestions to them, because this is all about awareness and finding ways to reduce the risk. And I think you already talked about, keeping paths clear. So I'm going to go on that a little bit more, just like improving lighting. I like night lights. I strongly recommend little night lights in the garage, in the bathroom, in the hallways, so that if you woke up in the middle of the night, you could have this low level of light anywhere that you go. Another thing that I had one patient who she tripped on her bedspread because when she, pulled the bedspread back onto this part of the bed, it was laying on the floor. She got up to go to the bathroom, whoop, slipped on her bed. I mean, things you're not going to see this in some paperwork that you read about. Tripping over your dog, seeing that sadly too much, because they can be such great companions, and yet we need to have that awareness of where our dog is, especially if they're black and it's dark. Move on here. This kind of gets into the importance of using, don't be afraid to use a cane. I was so happy to see some walkers in here and some canes, because some people are embarrassed or don't want to use it, and they can be really helpful. It has a little spot over here. Oh, I got my little mouse here. The night lights. This talks about the importance that Amber's going to get in later about the importance of doing strength and balancing exercises. There's a yoga mat. Medications I'm going to get into briefly on another slide. This standing up slowly to avoid dizziness or just basic lightheadedness. As we get older, There's a thing called orthostatic hypotension. It's when your blood pressure drops when you go from a lying down position to standing. And just think about just gravity. Guess what? Not so much up here. It takes a little while for the blood vessels to constrict, to bring the blood flow back up to the brain. You go, oh, okay, it feels so much better. Doing this slowly. And I talk about taking a few deep breaths, maybe a full minute, which seems like an eternity when you need to get up to go to the bathroom at night. But just to realize a fall is much worse than, having a minor accident. So, but just to be aware of that, to sit on the side of the bed before you go to a full standing, just kind of take a deep breath between each of those position changes. This kind of talks about one of the, what kind of I talk about a little bit when I have time, how primary care is these days. But measuring orthostatic blood pressure, that's checking the blood pressure lying down, sitting and standing to see if there's a drop of about, 20 millimeters of mercury in the top number, the systolic, or maybe 10 in the diastolic. Looking at vision, so being aware of, that not being able to see well can increase your risk. So, macular being tested, having regular eye exams. I don't do the formal eye exams, but looking for macular degeneration, the beginning of cataracts. At night when you get up to go to the bathroom, are you putting on your glasses, or are you like, oh, I know where everything is? Having your glasses right next to your bed. Footwear, oh my goodness, flip-flops, Uggs, clogs, anything. If you lifted up your shoe and your foot and you went like this, and if your shoe falls off, that is probably not a good shoe for you. Okay, because I can't tell you how many times I have seen people fall in flip-flops, clogs, and Uggs. And Uggs are like the ones that are just really wide, so you think your foot is this big, but because the Ugg is out to here, it catches on things. Oh, my foot's so much bigger in those nice, do you guys know what Uggs are?
Yes.
Okay. I also talk about the importance of vitamin D. You get it from the sunshine. We're frequently covered up in clothes, sunscreen. We're not absorbing the vitamin D from our sun. Many people need a vitamin D supplement, making sure you're getting adequate calcium. Primary source is dairy products, but there's lots of things like orange juice that are fortified with calcium. Medications linked to falls. It's a lot of the over-the-counter stuff. Anything that has the word PM in it, that's Benadryl, that's diphenhydramine. That means they're gonna put you to sleep, but they're also gonna make you less alert and make you more susceptible to falling and not being able to, like, even if you catch your foot, to like have the reaction time to catch yourself. So there are other medications, such as melatonin that might be helpful, something that is not gonna affect you as much. I'm sorry, I'm going a little bit on the Benadryl thing. It is on the list of what they call Beers medications for people over the age of 65 who should not be using them, okay? Not be using them because of the risk. So there are alternatives. And if I had someone who just needed to take Benadryl and I said, okay, well, maybe twice a month, but really, really, really try to minimize it completely as much as you can. So, and that's something that you can talk to your primary care provider about. Prescription medication, so people who have diabetes, who take medicines to lower their blood sugars. Sometimes if you didn't eat, but you still took your medicines, that's gonna make your blood sugar much lower, putting you more at risk. People who are, this is a picture of like CBD, that some people will take for pain medication or to help with arthritis or muscle aches. It can also increase your risk of your balance and your awareness. So to just be aware of that, minimize that, being aware of it. CBD, like CBD, marijuana, CBD, THC. So some people will be using those. diuretics, for people who have heart failure. Diuretics are the medications that help to get rid of extra fluid within your body. Those can reduce your blood pressure, and make you more susceptible to that orthostatic hypotension that we talked about, going from lying down to standing. Many heart failure medications or other heart medications, high blood pressure medicines may need to be adjusted. I even did this with my mom. She has heart failure, and she was just having all this dizziness from being on this diuretic, and it was a choice of, do you treat the heart failure or do you run the risk of falling? And it's a balancing act that needs to be individually assessed. And I kind of got into, there's a whole list here that I won't go into, but it'll be available if you need this. But it does talk a little bit about some of the medications, even for bladder control, can cause some lightheadedness or dizziness, muscle relaxants as well. Certainly prescription pain medications, narcotics, certainly have some mind-altering effects that can increase your risk of falling. I got ahead of myself on the shoes, so I can skip this one. But that does talk about,
It's so cute.
It is. Shoes, loose shoes that lack laces, straps. And then, it's really hard not to talk about osteoporosis when we talk about falls and the risk of fractures. I'm sure many of you know about osteoporosis. It affects about 2 million people in the United States. 70% of those are in women, most of those postmenopausal women. So usually it's, you get your strongest bones, the bone where your bones are the densest is probably around age 25, and it's unfortunately kind of downhill after that, but primarily goes downhill around age 50, around the time that for women you're losing your estrogen and progesterone. And so, but things that can cause you to go into menopause earlier. So menopause before the age of 45 puts you at more risk. If you had to ever be on steroids like prednisone for more than, say, 3 months, that can put you more at risk. Having disorders like seizure disorders like epilepsy, hyper or overactive thyroid, other adrenal diseases can also put you more at risk. If you've had any kind of chronic stomach issues with malabsorption of calcium and vitamin D, that can put you more at risk. If you're underweight, like if your BMI, your body mass index is less than 20, that puts you more at risk, or women, or anybody really under the weight of 127 pounds also puts you more at risk. So, they recommend a bone density test screening for everybody, or at least, I'm not getting this right. It's definitely women over the age of 65. Men, if they've had, if they're small boned, if they've been on hormone blockers, that's for actually men or women. So men having their testosterone blocked because maybe they had a prostate cancer, and so they're taking a drug that's blocking the testosterone, that puts men at more risk for osteoporosis as well. And just talking about, nutrition, I think I briefed on the importance of calcium, vitamin D. Frequently, if we're on a vegan diet, you may need to be taking supplements. So calcium, vitamin D, getting good fiber in your diet. I like to recommend the rainbow of colors of vegetables and fruits, whole grains, and trying to avoid processed foods and a lot of sugar, minimize the sugar intake. The importance of hydration, at least I kind of use this rule of thumb, at least 32 ounces a day. It's all based on body size, but that's just of water. So if you get some other fluids in addition to that, that would be great. And I think as we get older, we lose our sense of thirst, and so we don't feel the need to drink. So I like to see these water bottles that we have here. This is great, you're drinking water, but just to realize that non-alcoholic beverages are really good, non-caffeine beverages are really good, because they will stay in you. I didn't mention earlier, but, you know, excess alcohol, greater than 3 drinks a day, also puts you more at risk for osteoporosis development. And, consuming lots of caffeine also can increase your risk of,
You did it. Thank you, Stacey. So this one's a little extreme, but. Okay, so I'm gonna show you how to do this since you didn't use it. So you just don't put your hand on it to move it to, or to use it as a pointer. And then just bring it over here and click it. I click the left clicker.
Left click?
Left click, yes,
Index
so,
finger.
yes. I know,
So
if you're
don't
watching
move
it,
it, like, just
so
right.
if you click over on the right, you'll see all kinds of things you don't wanna see. Okay.
I might ask her.
So Amber Cross is next. She is our physical therapist, and I'm gonna let her introduce herself.
Hi, I'm Amber, and I've been a physical therapist in the Rogue Valley for 8 years. I used to work over at Jackson County Physical Therapy until about 2021, and then I worked in Eagle Point. In the last year, I've been doing my own mobile outpatient physical therapy, and then I also recently started working at Asante Rogue Regional and Ashland Community Hospital. And in the hospitals, I do acute setting care, which is a much different beast. So in outpatient, I see patients who typically can walk in of their own volition and can perform exercises when I want them to. In the hospital, I see patients who have fallen and are in dire straits. And for all kinds of reasons. They may have tripped, they may have had that lightheadedness and lost their balance and fallen, or they may have had another systemic issue where they fainted and fell. So I see head injuries, I see broken bones, lacerations, people who have literally fallen and laid there for hours or days before someone calls the emergency services and can get them to the hospital. And then once they're at the hospital, they may be there for days or weeks or months, depending on the extent of their injuries. And the hospital is not a place that you wanna be for longer than a day. You don't even wanna go there in the first place, but the longer you're there, the more risk there is for a hospital-acquired infection or another fall.
I thought I was the bearer of the bad news.
So you're all here at this presentation, so it stands to reason that you're interested in staying active and injury-free, and you realize that exercise and balance training are an important part of that. And as someone who works with people from all walks of life and all different activity levels, I really appreciate you being motivated to increase your knowledge on fall prevention strategies. So we'll be going over some systems that contribute to maintaining your balance while you're doing your everyday things. We're going to talk about first the gait cycle. And simply put, gait is the non-medical definition is it's the manner in which you walk. It's how you walk. So really, it's a very complicated and coordinated undertaking for your body, and one of the most difficult motions that you can do while remaining upright and in control. And there are certain components of it that you want to do the right way. We should be doing it with not a lot of wobbling and deviating that would contribute to losing our balance and falling. So I just want to go through the cycle of gait, and it starts with our right foot in letter A, heel strike, which is the right lower extremity touching the ground. And then as we begin to place our weight on the right foot, called loading response, and then our right leg and foot fully supports us in C, so mid stance, as our left foot begins to swing forward. So if you'll notice, you're in a single leg stance at that point and right before. So that little line that goes from the front to where it says 60%, that's your stance phase. And then we have single leg stance, which is 40% of that time. That's the very end of B, C, and D, right before your other foot hits the ground, you're on 1 foot. And then we begin the cycle of the right foot lifting up and coming forward. And we need to be doing each of these steps with the right mechanics in order to avoid falling, okay? So in PT school, we have whole sections of classes devoted to gait, and this is a really simplified overview, but I think I'd just like to let it sink in that 40% of your time on each foot is single support, okay? And I thought that might mean 80% of your total time would be in single support, but that's not how it works, it's really 40%. But that's a long time when you consider, in standing, we're on 2 feet, and that's our most balanced position. So, things can go wrong with gait, and, that can happen because we lose our strength and flexibility in certain areas. And there are all kinds of reasons why we might become less flexible and weaker as time passes. Like our tissues become generally drier and stiffer and less flexible. We may have injuries that don't fully heal or resolve, or we might have disease processes that begin to affect our body's ability to maintain and control itself, like neuropathies and neurological diseases. So I just wanted to point out some of the most basic and common gait deviations so that you can watch out for them happening in yourself and the people that you are around. The first one is stooped over walking, and that might happen as our vision deteriorates. We might start looking at the ground more to see where our feet are going, and then we're walking like this. And that's a trip hazard, where we need to be scanning in front of us as we walk, and then check the ground every once in a while. It can also happen just because our backs become stiff and kyphotic, which happens normally as time passes, and also happens extra with extra slumping. So make sure you're trying to sit up straight and keep that back flexible. Shuffling happens as we get weaker just as a function of not being able to lift your feet up. It can also be a product of neurological diseases that affect our feet and legs, or it can be us trying to feel the ground as we're walking because we have less feeling and we're trying to keep our foot on the ground. Trunk sway might begin as we get weaker as well, and our bodies are attempting to propel us forward with momentum versus a controlled muscular stability. And that can look like, so trunk sway can look like, okay, so I'm kind of like swinging myself forward. I'm not really like controlled propelling myself forward. And hip drop. Hip drop is a big one. It comes from our side hip muscles. They're called gluteus medius and gluteus minimus. They're on the side of our bottom here. And if they are weak, they don't hold our pelvises straight when we're on one leg. So if I have a weak hip, I'm gonna like drop like this if I'm on one leg. So if I'm walking like this, I'm gonna have less stability because my muscles are not strong enough to hold me straight as I propel my foot forward. And then foot drop is something that happens. It can happen for several different reasons, but often it's happening because you have low back issues, and there's a nerve that comes from your low back, which is L5, that goes to the front of your leg that lifts up your foot. And if it becomes impinged as it exits the spine, it doesn't keep your foot up the way it should. Having your foot up, drop like that can also happen from a nerve injury along the pathway of the nerve. So that L5 goes through the sciatic nerve and into the tibial nerve, which is on the front of your leg and controls those muscles that hold your foot up. So if you can't hold your foot up while you're bringing it forward, well, you might trip. And then as you're setting it down, you're not gonna be strong enough to hold it up, so it will slap down real hard. So they'll call it foot drop. That's a tripping hazard because you can't hold your foot up the way it should. So, in brief, at a minimum, we should strive to keep our trunk upright, our head up, our eyes forward, scan the ground, or scan ahead and then check the ground if we need to, and roll through the foot from heel to toe and push off with our forefoot. Okay, so we should be propelling ourselves forward as our foot and leg come behind us. And there's reasons why you might not be able to do that well, and I'm gonna talk about those next. So if you're doing anything different, you should get with a health practitioner and ask them why. You also may need an assistive device like a walker or a cane, or what's called an AFO, ankle foot orthosis. If you have something like drop foot or any other gait deviation, you might need a cane or a walker just to assist you to make sure you're doing gait the right way, because if you are constantly doing it the wrong way, you could create other problems as well. So balance is contributed to by internal balance systems and can be affected by environmental factors, range of motion, and strength. The internal systems, we've already talked about one being vision, and that is you need to be able to see what's in front of you and what changes are happening in front of you and obstacles you're approaching as you walk. Hearing and vestibular. Hearing is another sense that will give you a clue to what's going on in your environment, but differently than that, there's a little organ inside your inner ear called the vestibular system that tells your brain where your head and body are in space. It's made up of a series of little semicircular canals that have little sensors in them that will give a signal to your brain if you're bent over, upside down, sideways, whatever. And things can go wrong with that as well. It has some liquid in it, and it has some little crystals in it. You probably have heard of vestibular vertigo, and so as we get older, we get less moist, and as the liquid dries up, there can be issues with those little crystals getting stuck in the cilia, which are the little hair-like structures that send a signal, and that can give you vertigo. So if you have anything going on with those systems, that can contribute to poor balance. And then proprioception or sensation is another internal system that's contributing to balance. We have receptors all over our body that tell us what our body's doing in space, and certain ones will send a signal to the central nervous system, which will do a quick reflex to adjust your position. So if I drag my foot, I should get a signal up to tell me to lift my foot, and that signal is not going all the way to my brain and back down, it's going quickly to my spinal cord and back down, so it should happen quickly. That also declines as time goes on. And then we have the neuropathy, which is the direct degradation of our nerves in our feet and legs, and that will not allow us to feel things as well as we could either. So we know that these balance systems become less effective in time, and we know improving our balance is inherent to reducing fall risk. So we should confirm the problem before we try to address it on our own. And confirming the problem would be going to your healthcare practitioner, your primary care provider, your physical therapist, your personal training, and saying, I think I might have a problem, what can I do about it? And your healthcare practitioner can do some balance assessments on you or send you to someone who can. So this is just one of the balance assessments that PTs, physical therapists use to test their patient's balance. It's called the 4-stage balance test. Shoulder width is where we should normally be standing. If I'm gonna test somebody's balance, I'm gonna have them stand in a narrow base position or a semi-tandem position, which is foot one next to the other, kind of staggered, or tandem stance, one foot right in front of the other, or single leg stance. So we should be able to stand in each one of those challenging positions for at least 10 seconds without wobble. If I'm seeing somebody in a clinic and I'm going to assess their balance, I may not even do this test for them because I might have been watching them walking or watching them moving around, and I know pretty much what their balance impairments are going to be before I test them. But if I am sure that they can do certain things but not sure about others, I might start them in a narrow base or semi-tandem, or just start them in single leg to see if they can stand on one leg. But this is not a test you should do on your own if you're concerned that you can't do it at all. This is a test you should be asking your healthcare provider to do for you. And then there are balance exercises that we can give you if we determine your balance is at a certain level. So range of motion also contributes to being able to balance and walk properly. If my hip can't go behind my midline, I'm going to have a gait deviation, like I might be walking really with little short steps. If my ankle can't bend, we talked about tripping. If my knees don't bend the way they should, I'm gonna have a lot more difficulty going downstairs. I might have to do a little hop or a little step too. So these are all things that are giving us clues that there's something going on and that you might want to address it. And we address range of motion issues in physical therapy all the time. There's all kinds of reasons why you might have decreased range of motion. We know what your normals should be, and we can often get you back where you should be, or at least functional. Our goal is to get you functional. And so muscular strength is a very important component of maintaining our balance. If you think about a building structure, you have the frame. If you don't have the supports and the siding, your frame's not gonna stand up for very long. So it's, our bodies are not sturdy without muscular support. Our muscle groups have to be strong enough to support our joints and hold us upright, keeping us moving with control, help us sit down and get up again, go up and down stairs, step over obstacles, and get ourselves up and down off the floor. If we can't do one of these things simply because we're weak, we're at increased risk of falling. The good news is the exercises to improve standing, walking, sitting, stairs, and getting up and down off the floor are simply to do those things more often and repeatedly. Or if you can't do them safely, break them down into smaller parts of those motions and do those things repeatedly as an exercise. So for instance, if I can't do a squat, I might just sit to a chair and then stand up again, like the lady up there, okay? If I can't get down on the floor on my knee all the way like this or back up again, I might just do a little motion like that to practice. And not everyone can do all of these things, so that's what physical therapists are for, is to help you find things that you can do, which will relate to these functional motions so that we can get you back moving. Get you going up and down stairs, get you sitting down and standing up more safely, and being able to get up and down off the floor. Because if you can't get up and down off the floor, what happens if you accidentally end up on the floor? Okay, so that's the most important thing, is for you guys to be safe. And if you don't know where to start, ask your healthcare provider, okay? Yeah, you can call us, you can ask your primary care provider for a referral, you can call your insurance company and ask who you can see or how you can get in. We all care about you and want you to be safe and healthy, so just call.
Can you go to the next slide, please?
Yeah.
Does anyone want to stretch really quick? Do you want to do some squats? All right. Betsy. For me. Okay. Wow. Have you learned anything? One thing? Okay. Okay, great.
I'll let you do the
Okay. Can anyone relate to that? Okay. All right. So we're gonna try and we're gonna go so fast.
Yeah,
we are.
right.
But remember, we're here for you, and I'm gonna send all this to you if you want it, and you'll have these resources. Okay. So this is Betsy. Talk about yourself for a second.
Okay, well, I've been working here at the Y as a trainer for the last 3 years, and I recognize many of you from training and from our classes here. I have a degree in exercise physiology and some clinical work as well. And then I'm a yoga instructor too.
Hey. And Betsy has about 60 people in her.
Yeah. There's a few of them here.
Saving Falls, this is me, I'm not gonna talk about me, I'm just gonna
Yes,
go
you
right.
should talk
No,
about you.
No, I wanna keep going, cause we're almost out of time. So, just to kind of piggyback onto what Amber was saying, movements, especially body weight movements, are incredible for your body because they are functional. Do you wanna talk about functional a little bit, or?
Yeah, we were talking a little bit about just certain exercises that are considered weight bearing, which are really good for our legs, our hips, and our core. And Amber mentioned squatting and lunging, which are perfect exercises that can keep our lower body strong so that we do move better, we can get up off the floor. And also when we're strong in our lower body, it helps our posture, pulls our shoulders back. So there's some really functional exercises that you can do to be stronger so that your bones are stronger as well to prevent falling.
And you can add fun to this with music or like squats. When I used to teach this class, I used to call it For Your Thighs Only and use the James Bond theme, or you can find any movie theme. I have a ton of them, but I don't want to take much time. But of course, movements, bones are in a constant state of renewal. They're constantly breaking down and regenerating. People don't realize that about bones because they think they're just hard and brittle. They're always breaking down from the outside, rebuilding on the inside. Does anybody remember what happens inside of our bones? A little red blood cell production? Yeah, right. And so, I mean, people forget sometimes because we had physiology so long ago, but it's just an incredible process. Bones like pressure. Your muscles like pressure. Everything likes pressure. We kind of have to be pushed to grow and learn, right? You know, not to the point of pain. In exercise, we like to say moderate discomfort. Go to moderate discomfort, not to pain. Pain is like the edge, and then you fall off, and then you don't want to ever exercise again because you can't walk. But here at the Y, we have a lot of classes that really, as you know, you all already know this. Okay, so bodyweight squats we talked about. Dumbbell press is really important for keeping the upper body strong. I've heard so many stories about people that can't get themselves up after a fall. And that process that happens where your body fluids can't move if you're stuck on the ground for hours. I mean, DIE, I don't want to end with that. End with anything bad. Lat pull downs also really important for the upper body. And hinge lifts, you don't have to use the big old not dumbbell, what's that called? Kettlebell. But it's just the action, right? And instead of rolling over like this, you stick your butt out. Do what your mom told you not to do, stick your butt out. Right? And I was telling my yoga class the other day, a lot of them, I'm trying to teach them how to go a little bit deeper without hurting themselves. And I said, when you go to sit down, whether it's just in a chair or maybe you're gonna go to the bathroom or whatever, just go, okay, once, and then do it one more time. Just give yourself 2 squats, right? Before you sit down, yeah, sorry. Oh, good point. And also another little tip is when you're going to go pet your dog or your cat, instead of doing it and hinging properly like you should and just leaning down that way, could you start to practice coming down a little bit deeper and use a chair, or go a little bit wider and kind of come down this way instead. Come down, like if you have a German Shepherd, you're good, because they're right here. But if you have a little dog, then you have to start practicing and going lower and lower, but watch those body mechanics, And if you have any questions, you can ask a personal trainer. We're here for you. This is my favorite. Can anyone relate to this? Right? Okay. So just take a second to read through this. That was a long time ago. We've known this for a while, haven't we? If we don't use the body, liable to disease, defective in growth, and age quickly, we don't want that. I'm not gonna go into this right now, but I'll send it to you in the slides. We talked about nutrition. We didn't really talk about sleep. I think it's I don't think so, but it's really important to get sleep. I know it's hard to sleep sometimes, but really important for renewal. This is the one I want you to think about really quick. Maintaining relationships and spending time with others is essential to a senior's emotional and mental well-being. Social interaction for seniors is as important as it can help prevent depression, which is prevalent among seniors. Being alone, we have 8 billion people on this earth, and people are lonely. It's really sad. Socializing keeps the mind active. Speaking of the mind, this is a depressed MRI, not depressed. And you can see all of this activity in the brain. And I always say when I show this slide from the Mayo Clinic how it's like you really are blue when you're down, right? And then I love this one. After a 20-minute walk, look how much you light up your brain. 20 minutes, and you're just on fire, ready to go, ready to solve all the problems of the world. Do you want to talk about atrophy?
Sure, just a few minutes. So, as we age, we start to lose a little bit of muscle and some bone, but we can prevent some of that from happening by engaging in regular activity and exercise and lifting weights. So a healthy muscle is nice and plump and long. As it starts getting not used or disused, it atrophies and gets skinnier and thinner. It's called sarcopenia. So when we're not super strong and viable, we tend to be more tired, right? So if you haven't exercised in a month, you actually feel more tired. Versus if you're exercising on a regular basis every day, you're stronger. Climbing stairs is easier. So maintaining muscle mass as we age is super, super important. So getting into the gym as seniors, love seeing you guys out there on the floor lifting weights. It's gonna help you in the long run.
The SAID principle is specific adaptations to imposed demand. It's what we use in personal training, progressive overload, and I'm gonna let Betsy take that, and we're almost done.
So in my classes, I see people lifting 2-pound weights, maybe 3-pound weights, and I'm constantly telling them, lift heavier. That is progressive overload. So you need to, as you're building muscle, if you stay with the same weight, that muscle's not gonna continue to grow. And so you need to progressively overload it by lifting a little bit heavier. And that could take a month or 2 months before you're ready to lift something heavier. But if you stay at the same weight forever and ever and ever, you're not gonna get stronger. So you have to overload the muscle for it to grow and get stronger. So important to lift heavier.
Yes, and people get scared sometimes with that, but it's just slowly progressive, right?
Yeah.
And that specific adaptation to imposed demand, I know it sounds wordy, but if you just think of the 2 examples, like think of Arnold Schwarzenegger, and then think of a couch potato, right? Like Arnold Schwarzenegger had to work hard to get the muscles bigger. We're not talking about like going that far, but a couch potato, you know, there's just nothing left. The muscles really atrophy. All right, so.
Oh yeah, the wobble. So, you know when you try to balance and you're wobbly? That's actually really good because a wobble a day keeps the brain at play.
And it keeps the doctor away.
And it keeps the doctor away. So when we wobble, and I think Amber may have talked a little bit about it, we're actually sending a message up to keep ourselves upright. So a message is being sent up from your ankles and your feet and all the bones in your toes to not fall. Get upright. So wobbling is actually a part of working our balance because it's sending a signal to your brain to stand up. So when we balance, we use our whole body to stay upright.
Tai Chi, yoga, great ways to balance, or take Betsy's balance class. We have one more talk speaker, and she's got 2 minutes, and she's so wonderful, but first, a little humor. Right?
Yeah, as long as it's not in the
You
right
need the
place.
exercise. Okay, so, thank you so much.
Yeah.
Natalie Metler, Natalie from the city of Ashland Senior
Hi
Center.
everyone.
Senior Services Superintendent, say
Yes,
that 3
I know,
times
it's a
fast.
mouthful, I struggle with it myself, so I'll keep it really brief because I know that you probably want some time for questions. I have brought, there should be enough for everyone here, but a brochure that goes over our services and activities and our current newsletter. So if you are not familiar with us, then that'll give you a sense of what we can offer at the senior center. We'd love to have you there. We are part of the city of Ashland under the Parks and Rec Department. We have a lot of free activities and some of our exercise classes have a small fee. We don't want to compete with the wonderful offerings of the Y, but if our location is better or something else, we have Tai Chi, yoga, line dancing, which is also great for balance and mental stimulation, and some classes that are specifically for strength and balance taught by Beth Morris, who's a personal trainer. So I really like that Jamie highlighted the importance of social interaction because that is something that we're really aware of in all ages. We need to feel connected to each other, feel meaning and purpose, and so I think that's sort of the bigger picture where we want to hold a community space where people can come and make friends and feel like they're part of a community with the staff and the volunteers and the community members all getting to know each other and looking out for each other. And that's about it. So, you know, a more holistic, I guess, approach to fall prevention. The exercise is really critical, but also that mental stimulation and having people in your life that you can call on for help, you know, that fall prevention team. You gotta get out there to meet people if you're gonna try to get them on your team. So, the brochure and the newsletter both have our email and our phone number and our street address. We are open Monday to Thursday, 8:30 to 3:30 p.m. So drop on by or call or come see us if you have any questions at all. I'd love to meet you if I haven't met you yet.
Thank you, Natalie.
And may
Okay.
I put in a plug for the senior center? It has been a godsend for me. If you haven't been there before, please show up. Wonderful way to make friends.
Okay, guess what time it is? So I want all my wonderful speakers to come up here in front, please, because they donated their time today, their expertise. I really, really appreciate each and every one of you. Thank you so much. And does anyone, oh, no, please, could you go out this way, sir? Sir? Too late.
I think he came after your announcement.
Yes, sir. All right, questions?
Many things it happens they fall and the door is locked. How do you enter and get out?
So if you fall and your door's locked, we're gonna start with a couple things. That 911 call taker you're on the phone with is gonna ask if you can get to the door, right? So that's one way. If you can't get to the door, and you live like in maybe an apartment or an assisted living facility, then we're gonna have a maintenance person help unlock the door. If it's a dire emergency and you're really in need, right, you're really hurt, we're gonna break that door open and we're gonna get to you.
You might have a key too if they.
Yeah, you might have a good hiding key. And if you have a good hiding key, we have a program called Community Connect. So it's a computer-based map, and you could put that information in for your house. Only us and the police department can see it. And if you need help doing that, you can call the fire department and we can help walk you through that, or just do it for you if you're not really familiar with computers.
Any other questions? I'm not trying to trap you in, I promise. Okay, well, thank you so much. Thank you. Thank you.
I have one comment that I've been in the medical field for over 50 years, various capacities. You mentioned sleep and melatonin. Be sure to talk to your practitioner about the amount of melatonin and where you get it, because there's a lot of different quality. Also, we start out with an ohm. If you do an ohm or chant of some sort, or even singing when you're trying to go to sleep, stimulates the vagus nerve, which goes to endorphins in the brain, and it helps you get to sleep. So
Thank
it's
you,
simple thing.
yes.
Yeah.
We could talk about that for a whole nother hour.
Yes.
Yes, it's true. Did everybody hear what he was saying about when you say om or you vibrate, you can gargle or sing, and it activates the vagus nerve, the 10th cranial nerve. And polyvagal theory, you could really geek out on that if you want to look it up, but it's amazing. It calms you down. So thanks for starting with that.
Thank you so much.
You're welcome. Was that okay?
Oh, it was great.
A lot. Thank you so much. All right, we'll let you out now. I'm gonna